So, I'm saddened to report that Hamilton County is seeing its biggest spike in new cases since the COVID-19 crisis began. Before I go there, let me thank Jay and Vicki for being here to interpret. So I'm going to read off the numbers for today. Today we have 4,098 positive cases of COVID-19 in Hamilton County, 665 hospitalizations, and 188 deaths. I'm going to put this in context for you in a couple of different ways. We always talk about the delta between last week and this week. The delta in positive cases is 782. So what does that mean? Remember that we've been doing these briefings once a week, and so I'm going to read off the last 4 weeks to help you better understand the context here and how these cases are increasing right now very dramatically. So we started at 166 a few weeks ago. The next week we were at 177. The next week we were at 398, and now we're at 782. So these are the deltas that I'm talking about. And so you can see that the new cases are dramatically increasing in Hamilton County. Related to hospitalizations, the delta this week is 37, but let's go back in time. In the same way, that delta for hospitalizations was a few weeks ago was 84. Then it went down to 46, then down to 33, trending in the right direction. Now we're ticking up and we're at 37. We're going to hear more about this number in a minute. But as you can see, we were moving in the right direction, and now we're starting to see an uptick. And these are lagging indicators. You've got the positive cases, then you've got the hospitalizations, and then you've got the death numbers. So related to the death numbers, the delta here today is 7. So let's go back in time again. A few weeks ago, the delta was 21, then down to 17, then down to 8. We are now at 7. However, this is a lagging indicator. And so the concern here is that as we see an increased spike in positive cases, we've got an uptick in hospitalizations. This lagging indicator, which is the death rate, is going to move up. That's the frame for today. That's the frame of where we are in Hamilton County. It's very concerning. So, and you may have heard Governor DeWine refer to this last week at his press conference. So why is this happening? Part of the reason is that testing has become more available in Hamilton County, and more people are getting tested and diagnosed with a positive diagnosis. However, the recent spike is too large to be explained by just this alone. So we've seen the trends. Hospitalizations are ticking up. And so let me give you a couple of specifics related to what we know. And Greg Kesterman's here, and he will elaborate on this. He is the expert in the room. But broadly, there are 3 zip codes that are concerning. 2 are particularly hard hit. Those zip codes are 45231 and 45240. So think about, it's kind of north central Hamilton County. So it's Forest Park, Springfield Township, Mount Healthy, North College Hill. Those are the areas we're talking about. There was a 3rd zip code that was highlighted by the governor, 45238. I'm going to let the health commissioner talk a little bit more about what we think is going on in 45238. So I've reached out to folks in these zip codes, in these communities, to not only make sure that they are aware of the uptick in positive cases in these communities and these zip codes, but also to offer the assistance of the county. So let's talk about that for a second. So county public health, in addition to city public health, are getting additional testing sites open in these zip codes, working with the Ohio National Guard to set up pop-up sites. So some of that's happening in the city. Next week, we're going to see that happening in the county in these hotspot areas. So look for those pop-up sites in the next couple of weeks. And again, I'm going to let Greg talk about the details of where those are going to be. We've got some additional information there. As we've said many times, there are already sites that are doing testing in Hamilton County. HCPC, the Hamilton County Public Health website, has a map, and I can find it. It is not hard to find, but there is a map, and the map indicates where all the testing sites are. I personally called some of them over the weekend and said, hey, you know, are you guys open? Are you at capacity? They are not at capacity, and so go get tested. They have capacity. Go get tested. They have different requirements, different hours. Some of them are free, some of them are not. So as you click on that website, on that the testing site, it gives you that information and a phone number. Call before you go to make sure that everything on that website is accurate and you're good to go once you get there. So you can easily find that on the county website. So those are already there. We're going to have more sites as I just described. So we have also seen some trends related to demographics. And again, Greg's going to go into more detail and he's got some charts. But what we have been concerned about is that the African American community is testing higher proportionally with positive cases than other communities in Hamilton County. So we've been doing the outreach we've talked about in the past, but I want to give a special shout out to Renee Mahaffey-Harris, who has really tried very hard to make sure that everybody in this community is getting this message, whether it's on Lincoln Ware's show, whether it's on town hall meetings, whether it's out to specific groups. We're working really hard to make sure that we are communicating effectively to all the communities that are impacted. The other demographic that you're going to see is an uptick in the Hispanic community. And so we have also reached out to leaders in the Hispanic community, Santa Maria, Sukasa, LULAC, some of the organizations that on a daily basis interact with folks from the Hispanic community in Hamilton County to make sure that they also have the information they need in a language that people can read. And so that is happening as well. So as you can see, there are many partners trying to message out that we've got a real concern here in Hamilton County. The message, by the way, is the same. Mask up. We all walk in here with these masks on. Mask up. Stay away from each other if you can, and wash your hands. It's the same messaging. We suspect that people have gotten relaxed. We were doing such a great job with this. But unfortunately, the suspicion is that people have kind of let their guard down. We need to ramp this behavior back up and make sure we're doing our part to keep people safe. So behave as though you've got the virus and that everybody around you has the virus, and do what we need to do. We know what we need to do to stay safe. So now more than ever, it's key that we practice all the things that we know to halt the spread. One last thing. So you've heard me talk about the CARES Act dollars and how the county is spending those dollars. You may remember that the county has committed $19 million to increase testing in this community. So an RFP went out, the results are in. I believe the provider that was chosen is being contacted this morning. It's going to take a minute to get the plan together, but $19 million worth of investment to testing is also going to be rolling out in Hamilton County. My understanding is Hamilton County is the only county in the state to commit those kind of resources to testing. Very proud of that. But so you can see how these things will kind of dovetail. So the pop-up sites manned by the, or staffed, I should say, by the Ohio National Guard will be up and running next week for probably a couple of weeks. The county testing will then roll in probably in about 30 days or so. So try to pick up where the pop-up sites leave off to make sure that we've got a robust testing complement here in the county, in addition to all the sites that have been up and operating for the last few weeks. All right, so that lays the framework. It's a challenging time. So Greg Kesterman, the Health Commissioner for Hamilton County, is here to elaborate. He's got some charts I think that will illuminate what's going on. And then Krista Heisen is also here from the Health Collaborative to talk a little bit about the hospitalization rates. And remember, we're always concerned about hospital capacity. We've been talking about, really, that's been a couple months ago when we first were in this. And so now we are starting, as we see more positive cases, we are starting to also become more concerned about the capacity of our hospitals. So with that, I'm going to turn it over to Greg Kesterman.
Thank you, Commissioner, and good morning. So I always like to add on to the numbers Commissioner Dreihaus shares and update with regards to those recovered. So within our jurisdiction, we've had 2,167 cases outside of the city of Cincinnati, Norwood, and Springdale. Of those cases, 851 have recovered. As Commissioner Dreihaus just indicated, we are continuing to see rises in the number of cases throughout Hamilton County. Weekly, I have been sharing a reproductive number with you. You think about the reproductive number in that if it's over 1, an outbreak will continue to spread. If a reproductive number falls below 1, the outbreak will begin to slow down. This morning, the reproductive number for Hamilton County is 1.62. For reference, last week when I was here, it was 1.45. Also for the region, it is 1.50 this morning, and last week when I was here, it was 1.10. While this isn't the only indication of an increase, it is one measure that we've continued to use throughout this pandemic. Also, I'd like to share a little bit about the spike that Commissioner Dreihaus just referenced on the slide that is portrayed. These are cases by day for Hamilton County Public Health's jurisdiction. We continue to see a significant increase in cases of COVID-19. Our team of contact tracers has been really busy over the last couple days. In fact, one day on Monday morning, we came into the office with 114 new cases to contact trace. So our team has been very busy and working very hard to make sure that they're able to reach these individuals and appropriately isolate them. It's important to note that some of this increase is absolutely attributed to testing. We're now able to provide testing to younger and healthier people, and even some people that are asymptomatic. We did not have this luxury early on in the pandemic. In fact, it wasn't until recently that we were able to test this group. So that's a good thing. We're able to now get out. We're able to now get young people who are not very symptomatic isolated appropriately. On the slide in front of you, you can see on the top half there, tests completed between June 1st and June 21st. You can really see below 60 is where the majority of those tests are occurring. On the demographics there, as Commissioner Dreihaus already indicated, we are continuing to see an increase in cases among non-Hispanic blacks as well as Hispanic individuals. This is concerning because we are sharing this message, but we need to make sure we're reaching the right individuals. Our office is continuing to make sure the message is appropriate and reaching the communities where we need to so that we can have the greatest impact. As Commissioner Dreihaus just shared, it is critical that everyone realizes the things that we can do to prevent COVID-19 are the same. We want hand washing. We want people covering their cough. We want people to keep sick at home. We want masking when you're in public places. These are the same things we've been talking about since February when we first started talking about COVID-19. I want to now touch briefly on the hospitalizations, but I'll save that for Krista to share in more detail. But we are absolutely seeing more hospitalizations and intensive care unit admissions. We know that if testing is showing more cases, the real numbers that were concerning to us are when hospitalizations increase. Testing has no impact whatsoever on hospitalizations, so it's very concerning to see these numbers start to go up. I want to touch base now on some of the zip code information. There's a slide that has the 3 zip codes identified by the governor highlighted there. The yellow dots are merely just a representation to help you see which zip codes. They don't align with any kind of a hotspot specific in those communities. In zip code 45238, which is in the southern portion of the county, we've seen increases in the number of nursing home related cases at one nursing home outside of Hamilton County Public Health's jurisdiction. In this facility, they have done several rounds of testing to ensure the safety of their residents. This aggressive testing absolutely causes spikes and increases in the number of cases, but it's a key tool for isolating individuals with COVID-19 and slowing the spread of the pandemic within that nursing home. So I applaud facilities for their aggressive testing. This is how we help control and save lives and prevent hospitalizations. In the northern part of the county, in zip codes 45231 and 45240, we're seeing an increase in cases among the younger population, as I just referenced. These cases are not associated with nursing homes. These are community spread cases. These are the result of people interacting in their daily lives, going to the grocery, playing baseball games, and sitting too close to people. These types of things spread COVID-19 and really need each of us to take serious and each of us to do our part to helping slow the spread of COVID-19. Commissioner Dreihaus referenced the National Guard coming. They will be coming to 6 locations within these 3 zip codes that I just identified. The National Guard will be setting up no-cost test site locations, which means if you don't have insurance and you don't have resources to pay for a test, you can still get tested at these sites. We are very happy to partner with each of the jurisdictions as well as the National Guard to make sure that there is access to testing right where the communities need it. The goal is to make sure that these sites are accessible, and we'll do our best once we get the times and dates today or tomorrow to push that out so that we can make sure that everybody knows where to get those tests and what's needed to get them. Commissioner Dreihaus shared our website. I continue to want people to go there for testing, hcph.org. It's a great resource, and I think our team has continually updated it. When we get calls about sites no longer doing testing, we remove them. When we find out about new pop-up sites, we add them. So it's a very up-to-date resource for all of the county. And we've even started adding more sites exterior of Hamilton County that are close by so that residents on the border of Hamilton and another county are able to utilize those sites as well. So even though I just shared 3 zip codes and talked a little bit about the increasing there, if you look at all of Hamilton County as a whole, we are seeing increases in COVID-19. This is not a time to say, if I don't live in these zip codes, it doesn't impact me. It impacts each of us here in Hamilton County, the state of Ohio, and the United States. Now is the time to really start doing these prevention methods that we've discussed. Now is not the time to stop fighting COVID-19. We are going to be living with this throughout the rest of this year. There's no vaccine, there's no cure. The way that we fix it is by working as a team and doing prevention. I'll end there. Thank you very much.
Thanks, Greg. Next, we've got Krista Heisen from the Health Collaborative to talk about the hospitalization numbers.
Thank you for having me back, Commissioner Dreihaus. Again, my name is Krista Heisen. I serve as the Public Information Officer for the Greater Cincinnati Disaster Preparedness Coalition at the Health Collaborative. And the Health Collaborative is a nonprofit organization based in Cincinnati. We bring together those that provide care, pay for care, and receive care to solve challenging problems like COVID-19. Last time I was before you, I asked for donations of PPE. In Greater Cincinnati, you came through. Our PPE stockpile grew in a short number of days because of actions like staying home, donating PPE to medical and safety professionals. You have allowed our providers to preserve and receive the necessary PPE to safely take care of us all. The stay-at-home order was hard. Closing businesses was incredibly difficult. Our lives have been changed forever. But because of you, we have built a safety net in our region's hospitals. We have built up those stockpiles of PPE. We have not overwhelmed our healthcare system. By closing businesses, increasing telehealth appointments, and halting elective procedures, we have been able to conserve PPE. We have practiced innovative ways we can safely reduce the overall use of PPE. We have limited the spread of disease within patient care areas, but most importantly, we have protected our healthcare workforce so that they can continue to protect us. And you did that. But just because things are reopening does not mean the pandemic is long gone. COVID-19 is a concern in our region. In the past 12 days, we have seen a net increase of approximately 4 to 5 hospitalizations per day due to COVID-19. From Monday the 22nd to just yesterday, in Southwest Ohio, the number of COVID patients in our region's hospitals went up 6.4%, and the number of ICU patients increased by 17.1%. To give you a clear picture, 2 weeks ago, we had 65 hospitalized COVID patients. Now we have almost 120. And the number of patients on ventilators continues to rise. Community spread is rising, but let me be clear. These are not cases that can be attributed to nursing homes or skilled nursing facilities. COVID-19 is spreading amongst the public. The 20 to 30 age range demographic has had the largest increase of positive cases recently. This demographic is of a special concern because this group is highly mobile and may spread infection to those both older and younger. We want our businesses and communities to thrive, but this requires both employees and the public to stay healthy. Do not take unnecessary risks. While we all want to be around family and friends again, I know it was hard not to hug my own dad on Father's Day, but there are ways that we can control the spread of this virus, like both said before me. Wearing a mask is just one of those simple ways you can protect others. Whether you're at the grocery, the Little League field, or grandma's birthday, precautions must be taken in order to protect the most vulnerable in our community. Together, we can take actions both for ourselves and for others to stop the pandemic. Right now, Greater Cincinnati residents must continue to do the following things. Avoid large gatherings and confined spaces whenever possible. Clean your hands frequently with soap and water for at least 20 seconds. Use a hand sanitizer with at least 60% alcohol when out in public or when you cannot wash your hands. Cover coughs and sneezes in your elbow or upper arm. Wear a mask in public or when social distancing is difficult. Stay at home if you are sick or do not feel well. Maintain social distance in public. Do not delay medical care if you are sick. Our hospitals are doing well on capacity right now. If you are a high-risk individual, please consult your primary care doctor or closest urgent care for additional precautions. But most importantly, if you have been tested for COVID-19 and are awaiting test results, it's important to isolate at home until you have the results, even if you are asymptomatic. For questions and additional information, please continue to get your information from reputable sources like your local and state health departments. Thank you.
Thank you, Krista, sorry. All right, we are ready for questions, Bridget.
Our first question is from Scott Wortman with the Inquirer for you, Greg.
Good morning, Scott.
Oh, can you hear me? Okay, good. Sorry about that. I don't know what was going on there. Had a couple questions. One, do you have any idea why, like you mentioned in Delhi in the 45238 that it was the nursing home, but why would there be higher incidence in like Springfield Township, and why those areas in particular? Is there a reason, or have you been able to isolate that?
So both zip code 45231 and 45240 at the northern portion of the county have been high throughout the pandemic with cases of COVID-19. If you regularly visit our map at hcph.org, those two zip codes have been the darker shade indicating more cases. So if there's more cases in a community and we open things back up, there's more opportunities for the spread in those areas.
You know why those areas have been higher?
I don't have a specific reason. We do know that there are some dense housing situations, which can certainly lead to the spread of COVID-19. So that's one theory that we have.
Have there been any super spreader events or any like particular one event or instance that caused a lot of cases to spread?
We have not seen any instances such as that, but we do see instances where somebody might have a gathering at their house and a few cases get linked back to that gathering or a similar type events like that. But I don't have any information to say that one event caused a large portion of our case increase.
I know there's been concern that the protests might have caused some spread. Any indication of that?
We do not have any data to that regard. What I like to keep sharing is that a mass gathering is really any time right now defined as 10 or more people coming together. And just in the course of my daily life, I'm seeing this all over the place. I'm seeing this when I'm at a soccer practice and I walk past some baseball fields and there's 100 adults sitting on bleachers having beer and having no space apart from each other. That's a mass gathering, and that spreads COVID-19. The protest certainly is a type of mass gathering, and if people aren't wearing masks and aren't social distancing, it also can impact and cause the spread of COVID-19. But no differently than if we have a grandma's 80th birthday party this evening, and I have 40 people come over to celebrate grandma, that is a type of a mass gathering that can spread COVID-19.
One other question. I wanted to just clarify when the commissioner said that it was the highest spike we've seen since the pandemic started. Are we talking hospitalizations in the last week or the total number of cases? What specifically of all the figures you cited is the highest since the pandemic?
The highest is absolutely the case increase is definitely the highest right now, but we are definitely also seeing hospitalizations increase as well.
And the case increase in the last week or the last few days?
The spike has really been pretty much probably at this point about 8 or 9 days in total. 1 week ago when we were looking at the data and talking about it in this format, we hadn't yet really seen the spike, but now looking retrospective, those first couple days probably happened a day or two before this news conference. Come and go and vary.
So just to be absolutely clear then too, because he talked a lot about deltas and all that, and I'm not very mathematically inclined, but in that time, just so I could say the largest spike was, how many cases of or increase was that makes for the largest increase since the pandemic began?
I do not have that number. It would probably reference back to Commissioner Dreihaus's delta for the last week.
Okay, all right.
All right, so I'm going to do a math equation here on the side very quickly. So I will get that to you. But to be clear, and Greg said it, so the increase, the spike is related to positive cases. So it's not, we're not talking about hospitalization and death rates right now. Although hospitalizations are on the rise, it's an uptick, as we like to say. It's not a huge spike. The huge spike is related to positive cases. So more people are getting tested, more sites available. So that's the good news, and we're isolating those folks. But it's more than that. As Greg said, it's community spread. We suspect that people are getting tested more, but people are also spreading more. So that's the idea. I'm about to do a math equation, so I'm stepping away for the moment.
Thank you.
Next question comes from Chris Woodrick for you, Greg.
Sure. Good morning, Chris.
We thought we fixed that.
Chris, if you're on mute, if you could unmute.
Sorry, Greg, can you hear me now? Good morning. I think a few weeks ago, maybe even more than a month, I lose track with these things at this point, but you had said, hey, look, if you're going out to dinner with people you're not quarantining with and all of that's not the right thing to be doing. What would you say about that today? Should you only be socializing and going out to dinner or whatever? I mean, with people that you're quarantining with, what advice would you give people on that?
We all have COVID fatigue. We are all tired of COVID-19. We are all ready to get our lives back together and get things back to normal. But if we are opening our family up to new families and to new activities where we're not social distancing, we increase the risk of COVID-19 for our family. So it's not unsafe to eat out. Our restaurants are safe, our businesses are safe, but we each as individuals need to make sure that we're not putting ourselves into a location where we can't social distance and where we can't mask. I've used this example several times, but if I go to a restaurant and it's crowded because a lot of people are in the restaurant or because nobody is wearing masks and you feel uncomfortable, we each need to take the personal responsibility to take ourselves out of that situation. As consumers, if we're doing this enough, eventually we will drive all businesses to operate in the safest way that can help slow the spread of COVID-19. So back to your original question, if you decide to spend time with a couple other families and you're doing so carefully and safely, I think that's appropriate. But if you're starting to clump people back together, it does contribute to the spread of COVID-19 and can cause for folks in the families to get sick.
And then I have one question for Denise, if she is able to step back when she gets a chance.
Yes.
Denise said, are you and any other local leaders, mayors and whatnot, are you discussing any kind of imposition of new restrictions or regulations locally to address this? And if so, or if not, why not? And walk me through your thinking if possible.
Well, from the county perspective, we have in the past taken the lead from the governor. And so Greg, I know that's his perspective on this. He has the authority to close things down. And so I have not had that conversation with Greg nor the governor at this point. I also haven't talked to the mayor about that, and I haven't heard him say it. I think the larger issue is to make sure that the behaviors of folks that live in the county people are reminded that we need to continue to be safe. I'm hopeful, obviously, that we don't have to reverse anything that we've done here in the recent past. So just haven't had those conversations, at least not at this point. Scott, so I did look through my notes, and so as we have made our way through the last couple of months, the delta is the difference between one time frame and the other. It's the change, right? It's the increase. And so that has been 100, 200, 80. It's varied as we've moved through this. I'm going to reiterate the last 4 times we've been together, and we've been doing this on a weekly basis. So these are 7-day changes. So I'm going to read them through for the most recent time frame. So in the last month or so, the differences in positive cases, the delta, is 166. A week later, the increase is 177. A week later, and this is the last time we were together, 398, so starting to tick up. Today, 782. So you can see how dramatic that increase is. We've never been at 782 before. And so that's, when I refer to the biggest spike, that's what I'm referring to, just to be clear.
It looks like our next question is for David Winter. David Winter, you are unmuted. Can you indicate who you'd like to answer your question?
Since Denise is up there, we might as well ask Denise a question. Can you hear me? Okay, good morning. Hi, Denise. Hey, a couple things. So first of all, taking devil's advocate here, I think everyone, and you even mentioned it, is going to say, yeah, big deal, big spike in cases. Well, of course there's a big spike in cases. You're increasing radically your number of tests. So truly, why the concern?
Hospitalization number is also going up. If we only saw more people getting tested and testing positive, first of all, those folks are being isolated. As Greg said, some of these folks are asymptomatic. So more testing, the better. We know who's positive. They get isolated and don't spread. So that's the good news, that more people are getting tested. But we're seeing an uptick in the hospitalization rate. And remember, that is a lagging indicator. And so the concern is that as we see this increase in positive cases, we are going to have that coupled in a couple of weeks, and we're starting to see it, an increase trend then in hospitalizations. You heard the number for ICUs, which is concerning, and then death rates are an even further lagging indicator. So the concern is that those are going to start to tick up here in the next couple of weeks. I mean, time will tell, and if we have reminded people what they need to do to continue to be safe themselves and to continue to keep their loved ones safe in this community, so be it. I will take the criticism that we overreacted and reminded people what to do. Will be happily taking that criticism. The concern is that that is not the case here. It's not just a blip. This is a trend, and we're very concerned that the lagging indicators are going to be going up.
And then do you happen to know, in reference to the asymptomatic people who are being tested, I understand that percentage who actually end up testing positive. So, I've been hanging out with someone who I think may have had COVID, so I want to get tested. I'm asymptomatic. That percentage is about 1.1%, I understand. Is that going up, or do you know?
Greg, moving to the microphone.
So I don't have the exact answer on the 1.1% that you referenced, but in general, of all the tests completed in the region, we do know the positivity rate is between 4 and 7%, depending on what period of time we're looking. That does indicate the number of people that, a number of those individuals are obviously asymptomatic. The one concern I always have when we start talking about testing individuals that don't have COVID-19, get that negative test result, please remember that if you, in a week, start to have a cough or start to have a fever or any kind of symptom, just because a week ago you had a negative test result doesn't mean you have no COVID 1 week later. We need to remember that that test is merely a snapshot in time. And so always remember, if you're symptomatic or you have symptoms, please stay home. Keep sick at home. It's critical.
Greg, while you're standing there, a couple more questions. And just cut me off anytime, Denise, when I'm taking too much time. So first of all, Denise had mentioned that, she takes the lead of the governor and so forth. Obviously, we're a very populous area, and, the governor has to think of the entire state. If you're so concerned right now, why are you waiting to take action and not doing something either? I mean, I know no one wants to hear it, but I'll just say it, re-shutting down things, checking the system as we're supposed to be doing, as everyone said we would do. Why wait for this increased hospitalization? Why wait for this spike to then start spiking again?
So the number one tool right now for preventing COVID-19, we've been saying it, is this masking. Masking is not something a general health district can require. It has to come from the state of Ohio. So we are in communication with the State Department of Health and talking about the importance of masking, and I'm sure that that is one item that they are considering. With regards to specific businesses, I don't believe I have the authority to close down all sectors of business. I can close down a specific business if there's an outbreak associated with that business. If my team understood that a specific business was causing a significant increase in cases of COVID-19, our office would certainly be in touch with the Hamilton County Prosecutor's Office and my board to understand what steps are necessary to shut down that business. But I don't have the ability as a county health commissioner to close down the economy as the director of health did to slow the spread of COVID-19.
Okay, so the most you can say is wear your mask, wash your hands, don't gather in large groups?
That is the worldwide message for slowing the spread of COVID-19. There is no cure for COVID-19. These are very basic steps that we can do, but we have to work as a team to slow the spread of COVID-19.
And then can I ask Krista a quick question?
Hi.
Hi, Krista. You talk about hospital capacity. We're looking at what is very likely to be an uptick, or it is an uptick now, what is likely to be another, if not worse, peak. Can you please speak specifically to hospital capacity? Every other state is able to give us an area, it seems, is able to give us percentages. You know, we have a X percentage of beds available, X percentage of ventilators available. Are you prepared to give us that now, and why or why not?
I do not have that number in front of me, but you've got my email and I can follow up later today with that answer.
Okay, so you have no problem giving those numbers out?
I can see what I have available. A lot of it is adult beds, so keep that in mind as well.
Can you go into more specifics in reference to that and why that should matter?
So just for total capacity of beds, I have more available data on adult med-surg and adult ICU beds. So that wouldn't include things like Children's Hospital, but let me review the data that I do have access to and what I can share.
Okay, great. And let me ask you this then. With this impending spike, are you concerned right now with our capacity of beds, ventilators, and or PPE?
As of right now, not in this moment. However, in a week, could that change? Yes. You know, like I mentioned before, Greater Cincinnati did a great job of staying home, of donating PPE, of making those changes. But, you know, we've given our time to the hospitals to be able to build that capacity, to build those PPE stockpiles. So right now, this region is doing well.
Okay, thank you.
Okay, it does not appear that we have any other questions.
I thought there was one about the hospitalization.
There are. Do you have like hospitalization numbers over the past 7 days, kind of similar to what you gave
Yeah.
with the COVID cases?
Yeah, so let's walk through those. And as we've discussed, hospitalization numbers have been going down. So that has been a very good sign, a very good indicator until most recently when we've seen this uptick. So I will run through the same time frame that I ran through for the positive cases. So hospitalizations, a few weeks ago we were 84. That was the Delta. Again, this is always the Delta, always the change. Then we were down to 46. The next week we only had 33 additional. And now we're up to 37. So 84 to 46 to 33 to 37. So you can see that we've got a little bit of what I'm calling an uptick. I mean, it's a few additional cases. It's a trend in the wrong direction, which is the concern. And in a week's time, as Krista said, if we see that dramatically increase, we've got to take a really serious look at that. Now, many of you have said, look, you know, maybe it's just more people are getting tested. Maybe it is, right? And maybe this uptick is an anomaly. But from my perspective, and I think my two colleagues here share the perspective, better to err on the side of caution and, you know, alert the community about what we're seeing. The worst would be not alerting the community and then seeing these kinds of increases and not having sounded, you know, the bell to say, hey, everybody, remember how to keep yourself safe and how to keep others safe. So I think that, you know, that's obviously the message today. And, you know, we'll be back in a week's time. We'll have another briefing if need be if we see some dramatic changes here. You know, we're always, of course, open to do that. But at this moment in time, we just are trying to remind people to be safe. We know what to do. Krista said it, we've done it. We have done a great job in this community of keeping those cases down. If you look at Cuyahoga and Franklin and Lucas and Summit and some of the other large counties in the state, Hamilton County, by way of our population, has done a pretty good job at keeping cases down, at keeping hospitalizations down, at death rates are down. So we know what to do. We've already done it. And so this is a reminder to keep doing it. Yes, have things opened up? Yes, but safely. You know, I've recently gone to a restaurant, ate in, the tables were 6 feet apart and everybody had a mask on. We know what to do. So, you know, some of these other gatherings that Greg describes, you know, maybe some folks have gotten lax. It's not time for that, right? It's time to buckle under and continue to do what we know how to do. So that's the message for today. So thank you all for joining. Appreciate it. And unless we know otherwise, we'll be back here next Wednesday. Thank you.